One. Hi everyone, it's Nigel Giam here, the lead GP training program director for St Mary's Scheme and course director for Mentor, Med Education and Mentor SCA. I'm really happy to have Altay join us today to share his SCA success story. It's been quite a journey, hasn't it, Altay? Quite a journey.
Yeah, it's a very long journey.
Yeah, and we have reached now obviously a fantastic score. I mean, 93.5, that's huge. I know when you reached out to me several months ago, you were quite low. I mean, you taking the exam three times. I mean, you were close, but still not quite getting into that mark zone. I mean, before we go into that, I mean, how you jumped your mark from, high 60s, 25 marks later, 93.5, amazing. What's your story into general practice? Just share it with the audience a little bit.
So I joined the GB training around the end of 2020, coming from Ireland, Republic of Ireland. So I worked in emergency department over there, did my memberships in emergency medicine, and then decided to change my career and join GP. Um, so because I was just doing trust grade rather
Yeah,
than kind of
yeah,
training.
yeah,
So then the GB training was pretty okay in the beginning. Passed my AKT from the first attempt, was doing fine,
yeah,
happy, thinking that I will finish. Then stuck with this exam
yeah,
for a very long time. Like I
yeah,
was supposed to be finishing end of 2023, but
yeah,
it's
yeah.
finishing now. So it's been a bit of a
It
journey.
has been a journey, and I was so happy when I got that text message for you because not only did you pass, I mean, you smashed the exam. I mean, like properly smashed it. I mean, that is a really high score, but that does require quite a rewiring of strategy. And I know when you came to see me on the masterclass, we were kind of beginning to seed those changes, but I thought it'd be really useful for the audience because right now we're looking at a huge number of people that failed the June sitting. They're going to be taking it in autumn. Some of them will have failed it a bit like yourself, second, third time. Mark's not getting better, Mark's getting worse, and they're really lost. They're lost with where to go. I mean, what did you learn from the course and from our coaching sessions in terms of what are the game changes? What are the main game changes for you? Maybe we'll split it into data gathering first.
So I think the game changers, starting with the data gathering. I think one of the most important thing is that getting the eyes early.
Yeah.
The other more important thing I think as well is not over icing because that takes you
Yeah.
to being robotic and being like scripted. The other kind of thing that's really you were talking about is, not just to ask kind of questions randomly. Do you smoke? Do you
Yeah.
drink alcohol? Tell me a bit more about yourself. This is not
It's not going to work.
really helpful. And using the brief, we do sometimes use the brief, but using the brief from the start because it's part of the story, as you mentioned.
Exactly.
Yeah, so using the brief from the start, that gives you more time, focuses you towards the narrative of the patient rather than kind of wandering around or just using it at the end or in the clinical management. So from the start, that was one of the biggest thing
Yeah.
that even when I look back at the feedback, it was about like this is one of the failure kind of reasons why you're not using the information given.
Yes. Yeah.
That was a big game changer for me, I think.
Yeah. And I think that's so important because I think a lot of people who sit this exam don't actually understand this concept of when I say story before symptom, what that actually means. The story starts in the patient's notes.
Exactly.
We're coming into the journey often later, so we need to understand what's happened, why it's happened, and how do we incorporate that into how we take a history. Um,
Yeah.
I think a lot of
The
the
life
challenge. Go ahead, yeah, go ahead. You go.
the LICEF concept as well is really
Yeah,
kind of helpful. Not only eyes, just the life of the patient, the feelings, and it
exactly.
just gives you all the kind of the complete picture of the situation.
I like the way you've explained that, which is the complete picture. Because what tends to happen is often ICE can just be another acronym of ideas, concerns, and expectations. Formulaic,
Yeah,
smoking, alcohol. What we're really interested in is actually ICE within the context of the big picture, how it affects one's life, how they feel about it, to make us understand the patient's narrative. So that's really important. Clinical management, what do you think your game changers were there for you?
so the clinical management, I think one of the biggest thing is that obviously the addressing the agenda of the patients is the first thing, but also not only kind of taking your time in addressing that agenda. And I think that's the main thing that gets you clear, boss. And I
Yes.
from the thing that are different in your course is that you say diagnosis like it's not a tick box exam. So it's not, there's a lot of courses out there that's talking about like, did you mention vaccination action plan?
Yeah,
Did you mention this? It's not about that. It's about
yeah,
in the context of this patient, discuss the most important thing
yes,
for this patient
yeah,
and use kind of focusing your management with the patient's health belief
yeah,
or kind of these kind of things. That's the main, I think that's the main thing of the case.
yeah,
Like if someone is overestimating something, you reassure him. If underestimating something, you tell him how important it is. If he's like, you know, doesn't think that he drinks too much, for example, but
yeah,
it actually drinks, ask him why, and then in the
yeah,
management address that why,
yeah,
this is probably the main kind of thing that gets
yeah.
you the clear pass rather than
I,
tick
I,
box.
I, I absolutely agree. And actually, I think what's really interesting is what you've highlighted here is that we are trying to manage patients and their agendas. And actually, what was interesting is that you said if a patient kind of underestimates something, and actually what we need to say is, well, actually, it's potentially a bit more serious, or maybe they've overestimated something, and we want to kind of give them that reassurance. Often there's a conflict of agendas, isn't there?
Yeah,
And that
yeah,
and that
and
and that brings us
that's what
really nicely.
comes
Yeah.
the dilemma word.
Yeah, yeah.
Yeah,
And I think that's so important because I think when people look at, if we move on to the relating to others bit now, is that people sometimes think, well, actually, I'm nice. I'm good with patients. I've got good MSF and but I was really nice in the exam and I still felt relating to others. So, what is actually relating to others to you? And how do we get someone? Because I've got a lot of people now who are saying, my relating to others is really bad. My mark, I'm saying ice. I'm trying to do it, but I'm doing what the patient wants me to do, but I'm still getting a really bad relating to others mark. So,
yeah.
what is the key here?
I think one of the interesting parts is that I also had a big problem with relating to others, and because I think I was quite kind of formulaic and looking. I think you gave me the heading. I think a lot of people tell you what to do, but they don't give you the heading, and I think the heading is AEE, what
Oh,
you
I love
mentioned in
that.
your
Yeah,
course:
yeah.
knowledge, empathize,
Empathize,
and then
empathy.
energize. So you do have this kind of frame at the background. So and you just need to do what you need to do with
Yeah,
regard to that.
yeah.
And and that's really helpful. The dilemma word is really helpful because it takes a lot of burden on your shoulder.
Yes.
So once you say to the patients the dilemma, and a lot of the cases are negotiation cases.
Yes.
Once you say that word, you kind of said no already, and then you start to kind of negotiating your alternatives. So it
I,
saves you a lot of time.
yeah, thank you. Because today I really struggled on my masterclass with people going, dilemma, dilemma. It's such a weird word. I've never used this, but it's
Mm,
such a powerful word. And actually, the more you use it, the more you realize in everyday general practice, we're faced with dilemmas all the time, aren't we? I mean, we are.
yes.
And actually, working through dilemmas with patients doesn't have to be a really taxing thing. It's about sharing that responsibility. I'm so glad you've passed and passed really well. I was so happy when you sent me that message and that voicemail, actually, which was just lovely because I could hear the joy in your voice.
Yeah,
I
yeah.
remember after the masterclass, we had a session and um, I knew that the pressure was on you and I could sense that, but you had picked yourself up so much and actually that mark is fantastic. So well done again. I'm so happy for you. Um,
Thank you so much. And I think one of the biggest thing is that I want really to mention is because I do, given the fact that I've done the exam quite a few times, so I did work with a lot of
yeah,
friends. Some of them passed and some of them are still struggling. So I think the most important thing is, especially for IMGs, that they should really take this GB practice very seriously. A lot of
mm,
people comes from different specialities, and there is like this view that, GB is easy, 3 years,
yeah,
get it done, and a lot of them have MRCAs, membership
yeah,
exams, a lot of things. This is different. And
yeah,
it's not a cumulative exam. So it's not like, other kind of exams where you just read not that much, you didn't get the knowledge enough, then you do a little bit more and then you pass.
yeah,
It's not about that. If you
yeah,
don't change the whole concept, it's very unlikely that you will make any difference.
yeah, yeah. This is exactly what we start off with on the masterclass, which is that this is not MRCS, it's not MRCP, which a lot of us have. I mean, I've got MRCP, and MRCP was relatively straightforward because it was diagnostic driven, it was knowledge based. MRCGP is a completely different
It
game
is.
plan. It's narrative based, and this whole dewiring of clinically driven behavior in a narrative driven exam, it takes time. It takes time and strategy. And you put in the time, you put in the strategy, and you've showcased to yourself and everyone who's listening that this can be done. It's attainable, it's achievable, and you can pass really well. So thank you for that, and I hope other people find that inspiring because it is an attainable exam. Um, if there was one thing that you would say to someone who's feeling very down in the dumps right now, who's just got their June sitting and has failed and maybe done worse than before, what would you say to them? How can we pick these people up? Because there's a lot of sad people out there at the moment.
I think is getting the right advice and getting the right message. And I think probably I'll probably signpost into your course. It's not because I'm talking to you now, it's just
Mm,
because you do think differently. There's a lot of courses out there, and I think it's just important that you do change your concept
yeah.
because the way we have been trained, the way we've been doing a lot of things, you have to change the whole concept. You have to resist the temptations of ticking boxes.
Yes.
You have to kind of resist the temptations of like, I didn't mention this, I'm panicking about this. It's not
Yeah.
about that. It's not. And I think one of the interesting things that you've mentioned to me when I asked you, like, where do we get the knowledge from in terms of like clinical management and things? You said this is not a knowledge-based exam, and it's based more like the usual knowledge that you have on every day as far as you're
Yeah.
working and
Yeah.
safely practicing. So that means you are
Exactly.
okay to sit to this exam,
Yeah.
but you just need to know the approach. And I
Yeah.
think probably just looking into like your videos and trying to understand the concept of
Yeah.
LICEF, dilemma, these kind of things. And I
Yeah.
think you can easily, I even feel that I could have got higher marks without like, bottom, just silly mistakes.
Yeah. Well, I mean, it was a pretty impressive mark, to be honest, Altay. And, I think most people are happy with a pass, but to pass by 25 marks above what you did before is no easy achievement. Well done. I'm so proud of you, so happy for you. What's the plan now? You're going to be CCTing quite soon?
Yeah, in within the next 2 months. I'm planning to obviously get a salary course, trying to kind of work my way through. Maybe I'm also thinking about kind of joining a bit of a different pathway about, I love like the systems in hardened systems and all these kind of systems and I like the templates and things like that. So I'm thinking about how to join this kind of because it's a bit of a future.
Yeah,
So.
absolutely. Gotta move forwards with the times. Gotta move
Yeah,
forwards with the SCA.
AI things, you might see you as AI because
Yeah.
we need more of you to help people.
I may well be replaced by AI, but not quite yet. Listen, thank you so much for agreeing to coming on tonight. It's lovely to see you again. And
Thank you.
thank
Thank
you
you so much.
for your inspiring messages. I'm sure a lot of people will find them useful. Please promise to stay in touch and
All
keep it a very small world. We'll see each other
yes.
soon, I've no doubt. You take care of yourself.
Yes.
Thank you.
Thank you so much. Thank you.
Okay, take care. Bye.
Thanks.
Bye.